ماشي كويس. يلا خلينا نبدا. بدنا نحكي عن الجاوت واللي هو الاذر another disease related للجاوت. اول شيء طبعا quick introduction. The factors that determine the crystal formation اللي هو sufficient concentration of the chemical compound والtissue factor that promote or inhibit crystal nucleation and growth, which is يعني الفاكت يعني واحد عنده more شو اسمه lipids بصير في more likely to develop dyslipidemia. وليش؟ لأنه concentration أكثر. The inflammatory potential of crystals resides in the physical irregularity and high negative charge of their surface. So these إذا في عندك crystals شو اسمه have irregularity بالsurface, more likely to cause inflammation. The precipitation acute attack triggered when crystals release from their protected site, and these attacks result from mechanical loosening اللي هو local trauma, the predisposing factor, or partial dissolution and reduced crystal size occur in acute phase inflammation and response to intercurrent illness or surgery. So these are the precipitating factor بالجاوت. هسه شو هو الجاوت؟ الجاوت اللي هو caused by monosodium urate monohydrate crystals. That's why we talked at the beginning about crystals. These crystals اللي هو monosodium urate monohydrate crystals, crystal deposition بصير لها deposition. الdeposition وين؟ mainly بالجوينت وبالسيرفس تبع الجوينت. اذا في عندك واحد صار عنده تروما، واحد صار عنده ستريس، فهاي بصير لها ريليس. الريليس بتسبب اللي هو irritation للجوينت and then the acute attack will happen تبع الجاوت. The crystal deposition can be asymptomatic but gout can develop into debilitating illness marked by recurrent episodes of pain and joint inflammation that result from the formation of crystals within the joint space and the position of crystals in soft tissue. If untreated, can lead to joint destruction and, in the case of uric acid crystals, renal damage. The gout has a has a male predominance. The estimated prevalence of gout 75% in men واثنين بالwomen. This difference is largely a consequence of age at onset. Estrogenic hormones have a mild uricose-uric effect, and gout is therefore unusual in premenopausal women. The predominant age range of gout is 30 to 60 years. Usually, uric acid levels are elevated for 10 to 20 years before the onset of gout. يعني it affects young people. In men, uric acid levels rise at puberty, and the peak age of onset of gout in men is in the 4 to 6 decade of life. However, onset may occur in men in their early 20s who have a genetic predisposition and lifestyle risk factors. The women, uric acid levels rise at menopause, and peak age of onset is in the 6th to 8th decade of life. Uric acid is an end-stage byproduct of purine. Humans remove uric acid primarily by renal excretion when excretion is insufficient to maintain serum urate levels below the saturation level of 6.8. So this is the saturation level or the renal threshold. Uric acid hyperuricemia may develop, and urate can crystallize and deposit in soft tissues. 90% of patients with gout develop excess urate stores under excreta, produce excessive amount of uric acid endogenously. Overproducers. Few have impaired intestinal elimination of uric acid. In rare cases, overproduction of uric acid is the result of genetic disorders such as hypoxanthine guanine, phosphoribosyl transferase deficiency, اللي هو Lerschnihan syndrome, G6PD, and superactivity of phosphoribosyl prophosphate synthetase. The overproduction of uric acid may also occur in disorders that cause high cell turnover. زي واحد عنده leukemia وماشي على chemotherapy. Certain comorbid conditions are associated with higher incidence of gout, زي ايش؟ hypertension, diabetes, chronic kidney disease, hypertriglyceridemia, dyslipidemia, obesity, and anemia. So these are associated with higher incidence of gout. The secondary gout results from chronic hyperuricemia due to renal impairment or chronic diuretic use. So this is what we call secondary gout. The causes of gout flare, اللي هو gout attack. Individual gout flares are often triggered by acute increase or decrease in urate levels that may lead to the production, exposure, or shedding of crystals. So إذا بصير في عندك إذا بصير في عندك اللي هو يعني change بالليفل تبع اليوريت، بصير في عندك يعني fluctuation، بصير في عندك fluctuation بالليفل تبع اليوريت، ممكن يصير في عندك gouty attack. The changes بالurate levels can result from acute alcohol ingestion, acute overindulgence in foods high in purines, rapid weight loss, dehydration, or trauma. So these will cause changes bilurate level and might predispose gout attack. Medications that increase the uric acid levels via effects on renal tubular transport include loop and thiazide diuretics, niacin, low-dose aspirin, or cyclosporine A. Agents that lower levels of uric acid include radiocontrast dyes, xanthine oxidase inhibitors, they allopurinol and hypoxostat, and uricose uric, they propranolol. Primary gout mostly بالمن more than 40 mainly due to under-excretion, with secondary in patients more than 65 due to renal impairment or drug therapy زي thiazide. So these are the two reasons why a patient might develop secondary gout. كل الثانية اللي هي medication renal impairment. كل ال other causes اللي هي primary causes للgout. The clinical manifestations, the podagra is the initial joint manifestation in about 90% of gout cases, اللي هو the first metatarsopharyngeal joint inflammation to the point that it will cause severe pain. The spontaneous onset of excruciating pain, edema, and inflammation in the metatarsal pharyngeal joint of the grade 2. Other than the grade 2, the most common sites of gouty arthritis are ankle, wrist, finger joints, and knees. بس أكثر شيء اللي هو البوداجرا اللي هو inflammation بالفيرست metatarsopharyngeal joint اللي هو الكلينيكال أو اللي هو الكلاسيكال presentation of gout اللي هو what we call podagra. The gout attacks begin abruptly and typically reach maximum intensity within 8 to 12 hours. Affected joints are red hot and with very tender. Even a bed sheet on the swollen joint is uncomfortable. هذا البوداجرا gout attacks begin abruptly and typically reach maximum intensity within 8 to 12 hours. The first attacks resolve spontaneously in less than 2 weeks. Gout initially presents as polyarticular arthritis in 10% of patients. The other presentation to find اللي هو collection of urate crystals in soft tissue tend to develop after about a decade of gout. Untreated patients who develop chronic gouty arthritis to find may develop either in older women, particularly those receiving diuretics. Tophi are classically located along the helix of the ear, but they can be found in multiple locations including the fingers, the toes, prepatellar bursa, and along the olecranon. A25 Gout. الصورة مش واضحة، just search جوجل على الايمجز Gout. هاي هون باللارج 25 هذا مسكين صار له ديستركشن من 25 مع ديستركشن من انفلاميشن تبعت الجوينت، كل الجوينت عنده مشطوبة، وصاير عنده هون ulceration، ممكن يصير عنده انفكشن، هون effusion، هون 25. The complications of gout include the following: severe degenerative arthritis, secondary infections. زي ما هو شايفين هذا، مثلا واحد عنده ulceration بالسكين بصير عنده infection، واحد عنده الجوينت هذا وعنده اللي هو joint deformities بتصير في عندك destruction للجوينت. Secondary infection, urate or uric acid nephropathy, increase susceptibility to infection, urate nephropathy, renal stones, nerve or spinal cord impingement, fractures in joints with tophaceous gout. Few differential diagnosis: arthritis as manifestation of systemic disease, cellulitis, nephrolithiasis, rheumatoid arthritis, and septic arthritis. A synovial fluid analysis is the main workup step when a patient presents with acute inflammatory monoarticular arthritis. Aspiration of the involved joint is critical. So remember this, إنه أي واحد بيجيك عنده monoarthritis أو arthritis sudden, especially sudden, you have to do joint aspiration, arthrocentesis, to make sure that your patient does not have septic arthritis and to confirm a diagnosis. So this is mandatory. إذا جاك والله patient so having pain بالverse metatarsopharyngeal joint, redness, hotness, what's your next step? It's arthrocentesis. It's aspiration of the joint space. Okay. Involved joint is critical to rule out an infectious excuse me. الغبرة هاي بتذبح المخبضات الخماسينية. Anyhow, so when a patient presents with acute inflammatory monoarticular arthritis, aspiration of the involved joints is critical to rule out an infectious arthritis and to attempt to confirm a diagnosis of gout or pseudo-gout. فلما انت بتعمل يجيك مريض زي هيك do arthrocentesis and send for the fluid for cells count differential crystals وculture and sensitivity negative. طبعا شو انت بتاخذ الفلويد وسند you send it for crystals. فالمرضى هذول شو بتلاقي عندهم negatively birefringent urate crystals, so it's negative birefringent. I'm sorry. Urate crystals firmly establishes the diagnosis of gout arthritis. خلاص, this is diagnostic. So you send it for polarized microscopy and you send it for crystals for total negative birefringent urate crystals. This says 100% specific gout, so the patient has gout. If gout remains a clinical consideration after negative analysis findings, the procedure can be repeated in another joint or with a subsequent flare. Crystals may be absent very early بالفلare بالبداية. وهاي هي the crystals with serum uric acid. Measurement of serum uric acid is the most misused test in the diagnosis of gout. The presence of hyperuricemia in the absence of symptoms is not. So remember that. يعني مش كل ما بيجي عليك مريض والله بدي يا دكتور والله I think that I have gout, تروح تعمل له uric acid. خلاص اعمل له اياه once, that's it. And it's useless by the way. But so it might give you a hint if it's elevated that your patient is at higher risk of developing gout. So بس إنه الuric acid لحاله is not diagnostic of gout. Approximately 25% of the population has a history of elevated serum uric acid, but only a minority of patients with hyperuricemia develop gout. Asymptomatic hyperuricemia generally should not be treated. So يعني أنت عملت لمريضك ما فيش عنده gout، ما فيش عنده شو اسمه arthritis، ما فيش عنده symptoms of gout، ما فيش عنده signs of gout، وعملت له uric acid طلع elevated. There is no need to treat hyperuricemia. But the level of serum uric acid does correlate with the risk of developing gout. The 5-year risk for developing gout is approximately 0.6%. If the level is below 7.9, 1% if it's 8 to 8.9, 22% if it's higher than 90 milligrams, 9 milligrams, I'm sorry, per deciliter. So 22% if it's more than 9 milligrams. 24-hour urinary uric acid evaluation is generally performed if uricose uric therapy is being considered. Patients excrete more than 800 milligrams of uric acid in 24 hours while eating regularly, that they are overproducers and thus overproducers of uric acid. طبعا you don't need to do urine collection. The overhanging edges is pathognomonic, and I think this is the overhanging edge sign. يعني واحدة فوق الواحدة، واحدة فوق يعني طلع هون زي إنه overhanging، زي هون هاي الإدج فوق هذا الإدج، الإدج هذا فوق هذا complete destruction، هذا فوق هذا، كيف الهات زي الهات، يعني إنه إشي فوق إشي. طبعا هذا الجوينت لازم يكون زي هيك، يعني زي هيك من هون ما فيش إشي فوق إشي. سوري، يعني ما في شيء فوق، يعني زي هيك المفروض يكون. هون نفس الشيء، ما فيش عندك هاي النتوءات كلها. فالاوفرهانجينج ايدج از باثوجنومونيك. This is يعني هذا طلع عنده الجوينت منتهي بالمره، ومش ضايل عنده جوينت اصلا، يعني كومبليت اوبليتريشن للجوينت سبيس. هون صار عنده I think في عنده كمان باثولوجيكال فراكتشر والجوينت رايح، يعني هون ما فيش عنده اصلا distal phalanx، ما فيش عنده يعني منتهي، صار complete destruction. طيب التريتمنت patients education with diet and lifestyle recommendations. Consider secondary causes of hyperuricemia. Consider elimination of non-essential prescription drugs that include that induce hyperglycemia زي مثلا thiazide diuretic if you can give him an alternative antihypertensive medication. Clinically evaluate gout disease burden, the one in the palpable tophi, frequency and severity of acute and chronic symptoms and signs. Weight loss for those patients, for obese patients, to achieve a body mass index that promotes general health, healthy overall diet, exercise, smoking, and staying well hydrated. Acute attacks, non-steroidal anti-inflammatory drugs. NSAIDs are the drugs of choice in most patients with acute gout who do not have underlying health problems. Although indomethacin is the NSAID traditionally chosen for acute gout, most of the other NSAIDs can be used as well. Do not use aspirin. Low dose aspirin alter uric acid levels, so aspirin is not used to treat gout because low dose of aspirin will alter uric acid levels, increase the risk of gout attacks. So لو اجاك مثلا so aspirin is not used to treat gout. الكولشيسين, although الكولشيسين هسه قبل شوي حكينا عنه. Colchicine was once the treatment of choice for acute gout. It is now less commonly used than NSAIDs because of its narrow therapeutic window and risk of toxicity. Colchicine frequency therapy is ideally initiated within 36 hours of onset of the acute attack. Third, so في عندك بالacute attack, so the drug of choice أو first line اللي هو الأنسيد طبعا مش aspirin. السكند line اللي هو الكولشيسين. بعدين في عندك steroids whether it's systematic or intra-articular can be given to patients with gout who cannot use NSAIDs or colchicine. The steroids can be given orally, IV, intramuscularly, or intra-articularly. Long-term management of gout is focused on lowering uric acid levels. The goal of therapy is to reduce your serum uric acid levels to below 6 milligrams per deciliter at minimum. So this is your goal. بضلك يعني you manipulate the medications لحتى ما ينزل level of uric acid to less than 6 milligrams per deciliter. In many cases, lowering uric acid levels to less than 5 is necessary. يعني واحد عملت له نزلت اياه ل 5 ونص وظل يصير عنده attacks, go ahead and lower it to less than 9, to less than 5, I'm sorry. Indication for uric medications. Recurrent attacks of acute gouty tophi, evidence of bone or joint damage, associated renal disease, and gout with greatly elevated uric acid levels. Allopurinol, اللي هو xanthine oxidase inhibitor, reduce the conversion of hypoxanthine and xanthine to uric acid. Propranolol lowers tissue source of uric acid by increasing net renal excretion of uric acid through inhibition of tubular reabsorption. Alkalization or alkalizing the urine when starting propranolol to reduce the risk of renal stone. هاي بالنسبة للgout. So this is about gout. Now we move to calcium pyrophosphate deposition disease. Is a metabolic arthropathy caused by the deposition of calcium pyrophosphate dihydrate in and around the joints, especially in articular cartilage and fibrocartilage. Although calcium pyrophosphate deposition disease, CPDD, is often asymptomatic with only radiographic changes seen. اللي هو زي chondrocalcinosis, various clinical manifestations may occur including acute pseudogout and chronic arthritis. هاي الصورة للجوينت. يعني I think maybe this is the calcification and maybe between the joints شوية calcification because here should be clear زي ما انتم شايفين. But this might be the only manifestation of calcium pyrophosphate deposition disease. The 5 most common presentations of calcium pyrophosphate deposition disease: asymptomatic, acute pseudogout, يعني زيه زي الgout, acute or pseudo osteoarthritis, زي واحد affecting pain وبصير في عنده pain شوية inflammation بالكني أو بالhands, زي يعني osteoarthritis أو زي rheumatoid arthritis. شلون يعني بيكون في عندك symmetrical hand involvement, يكون في عندك morning stiffness or relief with activity, so زي rheumatoid arthritis. أو neuropathic joint, يعني بصير في عنده destruction للjoint وببطل يحس بالjoint زي neuropathic. Initially it might be painful and then later on might develop destruction of the joint because of this similar neuropathic joint. So طبعا how do you diagnose it؟ لما تاخذ البورصه، يعني واحد ما جاك مريض عنده arthritis واخذت له سامبل من الجوينت فبتلاقي اللي هو الكريستال تبعت الكالسيوم pyrophosphate deposition disease, which we will talk about in a second. طيب 6 and age related demographics. الكالسيوم pyrophosphate deposition disease is slightly more common بالwomen than men compared to gout. Well, exact female to male ratio is unknown, but probably 1.4 to 1. The acute pseudogout is characterized by acute monoarticular or oligoarticular arthritis. The pseudogout usually involves the knee or wrist, although almost any joint can be involved, including the first metatarsophrynggeal joint, اللي هو podagra, as occurs in patients with gout. The clinical manifestations are similar to those of acute gouty arthritis, typically presenting with an acute monoarthritis with pain and swelling, although generally not as intense. The pain بيكونش بنفس severity. Polyarticular attacks may occur on occasions. Occasionally, pseudogout may present as a pseudo-septic syndrome with acute arthritis, fever, leukocytosis with left shift. طبعا هاي اللي هي السيمبتومز والساينز تبعت الانفكشن اللي هو septic arthritis. But when you send the fluid للculture and do cultures, there are no or there is no growth to suggest that the patient has اللي هو septic arthritis. الورك اب laboratory test can include the following. طبعا كليتهم serum calcium, phosphorus, magnesium, alkaline phosphatase levels, iron levels, total iron binding capacity, transferrin, saturation, ferritin, thyroid stimulating hormone, T4 level. The crystals are طبعا الديagnosis بدك تشوف الكريستالز. The crystals are intracellular, rhomboid shape, weakly, positively birefringent and difficult to see compared لهذيك اللي تبعت الجاوت اليوريت اللي كانت extracellular كانت negative, strong negative birefringent. هاي لا strong positive birefringent وتكون intracellular زي هيك rhomboid shape. فthis is diagnostic. لما الارثروسينثيسيس you send it, you'll find the crystals. This is the diagnostic لل calcium pyrophosphate deposition disease. The management of calcium pyrophosphate deposition disease depends on the clinical manifestation. The asymptomatic calcium pyrophosphate deposition disease should not be treated unless it is a possible manifestation of other syndromes. طبعا ال asymptomatic calcium pyrophosphate deposition disease يعني when do you diagnose it, such as how you are going to diagnose يعني for any for some kind of reason. يعني واحد جاك عنده arthritis وعملت له arthrocentesis you send it for culture ولقيتها الكريستالز بالصدفه، طلع الكلتشر بوزيتيف عنده سبتيك arthritis هاي بالصدفه يعني you don't treat it. بس واحد لا ما طلعش غير هالكريستالز, this is a calcium pyrophosphate deposition disease that you have to treat. So asymptomatic calcium pyrophosphate deposition disease should not be treated unless it is a possible manifestation of other syndromes such as hyperparathyroidism or hemochromatosis. طيب يعني you treat the underlying cause. ما واحد عنده hemochromatosis بدك تعطيه اللي هو chelating agent, ممكن حتى انه اللي هو شو اسمه blood donation. الهايبرباراثيرويدزم بده surgery, treatment of which is important to prevent further end organ damage but cannot reverse the joint disease. The acute pseudo-gout may be treated by joint aspiration and intra-articular corticosteroid injection, systemic corticosteroids, non-steroidal anti-inflammatory drugs, or occasionally high-dose colchicine. And thank you, الله يعطيك العافية. These were يعني quick شو اسمه lectures, presentation للlectures. حدا عنده سؤال؟ بتوقع انه احنا هيك خلصنا المحاضرات, ما ضلش محاضرات اللي سامعني.
دكتور بس باقي محاضرة لدكتور مراد الكالسيوم ديسوردرز اتوقع.
ضايلكم بس محاضرة دكتور مراد هيك؟ محاضرة واحدة. طيب انا بس محاضراتي انا بتوقع هم بس ضلهم الفور
احنا خلصنا المحاضرات صح.
طيب ان شاء الله كل عام وانتم بخير
وبالتوفيق
جميعا, وان شاء الله بنشوفكم بعد العيد بالامتحان وبالراوند.
دكتور بس في عندي سؤال بالنسبة للسيمينار لجروب سي 8. دكتور كيف
لا
التنسيق؟
انا حكيت
دكتور تفضل.
نعم.
كيف راح يكون التنسيق؟ لانه في بعض الطلاب حكوا لي راح يكون بالجامعة, في بعضهم حكوا لي اونلاين, فما بعرف كيف الوضع.
يعني انا اوبن مايند, بدكم بالجامعه بصير, بدكم على اونلاين يعني اي دونت كير, اللي بدكم اياه نشوفهم وخبرني, اللي بدهم اياه انا مستعد فيه, اللي بريحهم. بيضل عادك شلون بيعملوه, انا حكيت لهم ذاك اليوم بالراوند يعني انه قسمون مثلا الايورتيك خلينا نحكي ايورتيك ريجيرج يعطوها الاثنين يحكوا عنها صحيح, يعني كل واحد اقل من دقيقه, بس يعني ذس از يعني الفير واي انه يعملوا برزنتيشن, يعني doesn't make any sense والله اثنين ثلاثه يحكوا الباقيين انه يضلوا ساكتين. فيقسموهم ويشوفوا مثلا الفالجر هارت ديزيزز, يشوفوا ايورتيك انسفشنسي, ايورتيك ستينوسيس, التوبكس هذول كليتهم وكليتهم يعني عندك قديش انت كم فالف, شوف التوبكس تبعتهم يقسموهم عليهم. شيء بده مثلا اذا زاد عددهم بده اكثر من اثنين, خليهم ياخذوا الشغلات اللي اطول زي مثلا الايورتيك ريجيرج. اذا ضل واحد او اثنين بدون ما يعملوا برزنتيشن ما فيش يعني حتى ما فيش عندي اي مشكله, يعني لانه بعرف انه عددكم كثير, فيقسموا التوبكس عليهم وبضل عادك بدهم اياها بالجامعه او على اونلاين على الزوم. هاي خبروني وزي ما بدكم خبروني, بس اقل ما في اليوم.
تمام اشكرك دكتور, ما بتقصر.
الله يعطيكم العافيه.
يعطيك الف عافيه دكتور. اهلا.